Now what is this? This is a lumbar puncture needle, and the color of the needle depends upon the thickness or the gauze of the needle that you are using. So higher the gauze, thinner is the needle. One thing. Why are you using this lumbar puncture needle? You are using it for CSF examination. How do you collect CSF? You bend the person in left lateral position to make the L4, L5 or the L3, L4 spaces more prominent. So that can also be done when the patient is sitting and the head or the neck and the knees are flexed, or you can put the patient in the left lateral position with knees flexed and neck flexed to make the space prominent. Second thing, indications of CSF examination. You need to do CSF examination for conditions of infection of the meninges, that is meningitis, or inflammation of the meninges happening in multiple sclerosis or Guillain-Barré syndrome, or diagnosis of certain leukemias or cases with CSF drop metastasis where a solid tumor or any other brain tumor would have metastasized to the CSF. Or it can also have a therapeutic indication when you use methotrexate to induce to give treatment for a patient of acute leukemia. So what can be the contraindication of this kind of a procedure? It would be a raised intracranial pressure that is present, and secondly a bleeding diathesis that has not been corrected. So before any procedure you need to have PT INR of the patient to prevent any sort of bleeding. Then what can be the complication? The most common complication that can happen after the procedure is post-procedure headache. That can happen because of the sudden drop in the CSF pressure that is happening. And another common could be herniation of the brain material. So all of these questions can be asked you when you are giving this instrument as a Viva question. So please be prepared, and a detailed video link has been shared in the description.